This morning we are taking a moment to specifically focus on the men in our lives and their specific health concerns. Urologist Dr. Khanh Pham from Overlake Medical Center and Clinics joins me now. Thank you for being here.
Oh, thanks for having me.
Well, I'm pretty passionate about this subject because my father-in-law actually died of prostate cancer. So naturally people who lose a loved one to prostate cancer get concerned. Is it going to happen to me? So what do men need to think about?
So typically when a man ages, they often go to their primary care doctors and they get screened for prostate cancer. And usually they do that after the age of 50 or so.
Right.
But when you go to a primary care doctor, they also manage your overall prostate health. So sometimes it's cancer and sometimes it's not.
Right.
And so oftentimes men think that their symptoms are reflective of prostate cancer when they may not be, and that they might just be related to their normal aging process.
Right.
In general.
The things that happen to us as we age. But it's important for all men to go. What age is a good time to go in and get everything checked out?
I think, around age 50 is a reasonable time.
Okay.
Yeah, that's when, I think screening starts and men start to have, urinary problems that might be related to their prostate.
All right, good to know. And of course, if you ever feel anything weird, you go to the doctor. Let's talk about BPH. What is it, and what are the negative side effects of an enlarged prostate?
So BPH stands for Benign Prostatic Hyperplasia.
Okay.
And so typically in a man, the prostate actually serves as a sexual function organ. However, as a man ages, the prostate can get enlarged over time, and it can impact urinary function. And so the prostate actually surrounds the urethra, and so the urethra is the tube that drains urine from the bladder.
Right.
And then when the prostate becomes enlarged, it actually can obstruct and occlude the urethra and make it more difficult to urinate.
And it makes you feel like you have to more often, is that?
Sometimes it does.
Okay.
Not always, but sometimes.
It's interesting. Speaking of that, can you give us a few more symptoms of BPH and who might be more at risk than others, if that's even a thing?
Sure. So like I mentioned before, men who are over the age of 50 can be impacted by BPH, and they're at more risk. Like I said, as a man gets older, the prostate gets more enlarged. And there are many different signs and symptoms of BPH. So there's typically two kind of categories of symptoms. There are what are called obstructive symptoms, and obstructive symptoms are symptoms like slow urinary stream,
Got it.
difficulty starting the stream, intermittent stream, and retaining urine.
Okay.
And then there's the other categories of symptoms, which are typically what are called storage symptoms, so that men have an inability or difficulty holding their urine in their bladder.
Yeah.
And that can cause urinary frequency, urgency, nighttime voiding, and sometimes incontinence.
It's hard to know which one, but would you just say overall, don't wait, don't listen to your body? Because I know sometimes men specifically have a harder time of just saying, I have to make time for this and go in and check myself.
Yeah, so I've seen over the years, many men will kind of say like, well, it's just a normal part of aging, and they ignore it, and they just assume that everything's okay, and they kind of suffer many years when they don't have to.
Yeah.
And so I think it's reasonable to, when you're having these symptoms, go see your primary care doctor, mention to them, they'll talk to that man and see, maybe you should see a urologist, that type of thing.
So once they come to you, how is it diagnosed?
So they're, mostly it's diagnosed by kind of a history where men will present with those complaints, like I just mentioned. Oftentimes a primary care doctor will examine the prostate, feel that it's enlarged, and they'll prompt them to ask them if they're having those symptoms.
Okay.
And like I said before, men will often not bring up these symptoms, and so they'll be prompted, hey, are you having these symptoms? They'll be, oh yeah, actually it's been going on for a number of years. And so then they'll be referred to a urologist, and then the urologist will do a more in-depth evaluation. And
then you can also do something called aquablation therapy?
Yeah, so
tell us about that.
Yeah, so aquablation, is a very exciting new technology that's been developed recently. It's been around for several years. And so Overlake Hospital actually is the only place in Western Washington, the region, that actually has this technology.
No kidding.
And so how it's done is that it's actually a robotic device. And it's essentially, a robotic computer that helps the surgeon be more precise with removing excess prostate tissue that might be obstructing the urinary tract.
Okay.
And so how it's done is that there's two devices that are attached to it. One's an ultrasound that essentially marks out the prostate.
Yeah.
And then those markings are programmed into the computer, and it delivers into the second device a heat-free jet of water at high pressure.
Wow.
And so as it moves through the prostate, it removes all the excess tissue that's obstructing the urethra.
Interesting.
Yeah.
And then you probably feel so much better afterwards.
Yeah, no, it's great. I mean, like, you know, we've had a lot of success with it in our group. You know, I'm one of 4 people that actually do it in our group.
Nice.
And so there's a lot of excitement in our group about it.
Thank you so much. Thank you so much for coming down here and for sharing all this with us and explaining it. Men, get out there, get yourselves checked. And if you want to learn more about what we discussed today or get in contact with Overlake Medical Center, just visit the website on your screen, overlakehospital.org/urology.